Hi, I'm Mary Michaels with Live Well Sioux Falls, and welcome to the Live Well Health Feed, the show that's designed to feed your mind with helpful health information. So I have two great guests today, and we're going to be talking about a very important topic. So with me today, Dr. Matt Stanley from the Avera Medical Group, University Psychiatry Associates, and Carla Salem, who's a certified social worker with Sanford Health. So welcome, both of you. Thank you so much for being here. So today we're going to cover some conversation about mental health and substance use. So before we really dig into that topic, will you just tell us a little bit more about yourself and the work you do? So Dr. Stanley, let's start with you.
Sure, thanks Mary, and thanks for having us. So I'm a psychiatrist and also have an interest in addictions. I've worked with Avera for over 25 years. I've done a variety of different environments of care, primarily acute care of late, and of course we've now have more of an addiction focus within our practice, and also active with our psychiatry residency program.
Great. Carla.
Hi, and thank you for having me today. Like you said, I'm a clinical social worker. Currently I work at Sanford as an IHT, which is kind of a behavioral health therapist within a medical setting, to kind of integrate more on the preventative, proactive side. And then for I have a part-time job that I've done for about the last 7 or 8 years, and I work for the Board of Mental Illness as an evaluator for Minnehaha County.
Well, great. So a lot of expertise here with us today. So let's just jump in. Okay, so we're in the winter months, the busy holiday season. We are still dealing with COVID, and people are really feeling it, aren't they? So, what are you seeing with the people you care for? What's our community dealing with? Carla, what are you seeing?
Well, I think there appears to be a lot of anxiety that's going on. Just by, the biological piece of moods would say that in the spring and summer we start having more energy, we get to kind of look more hopefully towards things as our serotonin is revived because of the longer days. We really didn't have that this year. About the time we would have revived was the time COVID came on heavy. There were all sorts of decisions to be made. Should I wear a mask? Shouldn't I wear a mask? Where should I go? What should I go? And it was just an overlay, and now we're starting back in August. We are starting with the shorter days again. And so I think that we just didn't get that natural kind of reprieve that comes with mood and with anxiety, and we're kind of feeling it.
Do you agree? Do you see the same thing?
I would agree. It was a tremendous factor. I think the other thing that we saw was when COVID first hit, at least here in the Midwest, everybody stayed away from healthcare, stayed away from normal supports. And we kind of felt like we were through it. We took a breath. People tried to resume normalcy. Lo and behold, as we know now, normalcy didn't return. We're still dealing with COVID. So we saw a real pent up, I think, people avoided care, avoided self-care, avoided a lot of things. We're actually setting records in terms of volumes in our inpatient, in our outpatient, as you, I'm sure would agree, Carla, has picked up tremendously. And one of the things we all know about COVID is it's forced incredible change in all of our lives. So there's financial stressors, grief, isolation. One of the hardest hit populations is our geriatric folks. So I do some telemedicine into some nursing homes. They literally feel like they've been in isolation for going on 6 or 7 months now. So end of life, the most important time to be close to family, and they can't sit down and have discussions. So, and that's probably true as you look at different segments of the population. We know that our high school seniors last year didn't go through. Our college freshmen are not experiencing college the way it's described. So tremendous changes and still a great deal of uncertainty about how this is all going to resolve itself and where we're going to end up.
And I know we've heard so much about that, about the anxiety, the stress, the loneliness. But I think there's also been quite a bit of discussion around what people have been turning to cope with, and that might be alcohol, it might be other substances as they're trying to process all of this. And now you get into the winter months where that's a concern anyway, but now amplified. And so we know that oftentimes mental health and substance use issues might go hand in hand. And I think there's a little bit of a stereotype or a myth or misunderstanding, a stigma about these issues, and that it's, you just don't have the willpower to say no to alcohol, or something like that, not realizing that these are real medical conditions. So Dr. Stanley, kind of going back to you, to talk a little bit about addiction. Like, what is it really?
Yeah, so it's a great topic, and we still fight this battle with mental illness, behavioral health in general, but it's probably even amplified when we talk about addictions in terms of it being some kind of characterological fault. What we clearly know is virtually every addiction ties back to dopamine, which is our kind of reward response neurochemical. And the thing is, it's probably about 50% genetics, 50% other factors, environment, biology, i.e., what am I exposed to? Honestly, if you never take a drug, you never get addicted to it. We found out that firsthand with opioids when prescriptions went up and all of a sudden, boom, we have an opioid epidemic, which is an incredible learning experience for us. Why do we have such a problem? Because we exposed a lot of people to a drug that turns out to have addiction qualities, which wasn't the belief when those prescriptions started. So it's kind of a lesson right there. Those are not all bad people. Those are people that got exposed to a drug, became addicted, and then it's taken off. I would say most of the people using and abusing now weren't necessarily exposed initially by a prescription. Now it's a very highly sought street drug. But exactly what you said, Mary, this is not a weakness. This is a medical disease. As such, we have to look at typical chronic disease treatment approaches, because that's the other thing about this. This isn't something you just quit and say, oh, I'm glad that phase is behind me. If you talk to most people in recovery from addiction, it is a day-to-day battle, whether you're 5 years out, 10 years out, or 20 years out. And that's one of the really difficult things about it. Your brain has now been primed to desire that drug, to need that drug. So it really is a daily struggle for those folks.
Yeah. So Carla, you mentioned, and it's great to hear about preventive care and kind of taking that proactive approach. So what can people look for? I mean, either signs in themselves or maybe signs in somebody they care about that there might be something going on, whether it's mental health issue or substance use issue. What are things to watch for, or are there some risks? I know Dr. Stanley talked a little bit about there's the biological, but are there some other risk factors that we need to be aware of?
Well, I think another thing that's happened during this COVID season is that relationships also have struggled because people are either together too much or they're divided or whatever. And one of the things that happens, one of the risk factors for substance use or addiction is not having that support system there, or having the support system that is being abused by the addiction, and then all of a sudden they're not there anymore because they're not going to be able to handle it. So a good support system or a lack of a support system could be a risk factor. The history of a mental illness, history of a family mental illness are qualities that go with addiction. How fast or how early someone started an addiction. We're born with our brain chemistry. Many people are born very anxious, and they notice about in junior high, high school that they're very nervous, but that's about the time alcohol or marijuana is introduced, and they find out, that makes me feel a little more confident. I feel a little bit more normal. So they continue on with the chemistry and not understanding that there's an underlying mental illness involved, that anxiety might be a little bit more of a problem than they ever believed. So starting young is also a risk factor. And then, peer pressure. We only think of peer pressure as children. However, adults have a lot of peer pressure as well, especially with alcohol, because every social event has alcohol. You go to a bar and say, I'm not drinking. People look at you like you're on the 12-step program or something's going on. You can't just not drink. So there's a lot of peer pressure that also is a risk factor. And so what you look for basically is changes, because all of those different kinds of things that you can become addicted to have different kinds of qualities, affect people differently. Meth addiction tends to bring out in many, many people just a violent anger. All of a sudden people are becoming very angry over things they never became angry about. With drinking, it can go from depression to being, elevated mood and very fun to be around. So you start just looking for changes in people. Look for changes in mood, look for changes in behavior.
This is a great discussion, and so important to really understand these so we can kind of knock down that stigma, to get people talking about these issues and seeking help and finding those connections that can get them to resources. So when we come back, we're going to talk about a new resource that's coming to our community to help people who are struggling with mental health or substance abuse issues. So please stay tuned and we'll be right back.
Hi, I'm Dr. Ryan Garretts from Falls Community Health. Now that the cold weather months are upon us, I'd like to talk about frostbite prevention. Frostbite occurs when skin is exposed to freezing temperatures. Here are some helpful tips to prevent frostbite. Protect skin from moisture, wind, and cold weather. Avoid getting wet. Layer clothing when going outside. Minimize time spent outside in cold weather. Recognize early signs of frostbite. If you have any questions about frostbite, please contact Falls Community Health or your local medical provider.
Welcome back to the Live Well Health Feed. I'm here today with Dr. Matt Stanley and Carla Salem, who are with our 2 health systems in town. And we've been talking about the very important issues of mental health and substance use. And these are really significant in our community. They're issues that impact anybody, anywhere. It doesn't discriminate. And we really need people to know how to access resources to help them. And so we're going to talk about one of those resources that's coming to our community, and that is the LINK, which is a community triage center. So Dr. Stanley, tell us a little bit, what do we mean when we say triage center?
Yeah, great question. So triage in the simplest definition is just taking a population that needs care in this case and kind of sorting out what level of care they need. So we bring people in and determine what their needs are. And really one of the purposes of the Downtown Triage Center is so that we're able to provide care to people, but at the right level. Typically when we have less levels within the spectrum, people tend to go to the highest level possible. So it's not a terrible thing, but it's probably a misuse of dollars and resources. So at the Triage Center, we're really going to have an opportunity to serve at least 3 somewhat distinct populations that we were talking about earlier. One of those being people with behavioral health that have a crisis, need a safe place to be, maybe a place to sleep, but to be evaluated for safety, initiate care, and really kind of create a treatment plan from there. The other population is one that's already served by the city, the sobering center. So those are people that are highly intoxicated, most frequently with alcohol, but could be other substances, and are really kind of put on a safety hold long enough for them to recover without really, it's not so much a medical treatment, it's an opportunity again to be in a safe place, a secure place, allow them to regain sobriety before they're back on the street. And then the third population is a little different level than we've ever had before, and that's medically monitored detox. So that would mean that if, again, let's use alcohol as an example. If you're intoxicated with alcohol, it's the opportunity for us to utilize medications to manage that withdrawal. Alcohol withdrawal, for instance, is one of the few withdrawals that actually can result in death. So it has to be monitored, and typically, the worse the addiction and the higher the level of intoxication, the more dangerous it is. So we'll have the opportunity to triage those, also obviously to refer back to a Sanford or an Avera if they need inpatient care, and also be connected to outpatient resources. So again, I think LINK is an apt name for something that should be, I think, kind of the center point of initiating those levels of care.
Yeah. So this is a facility that's going to be a great partnership. Not only it's the city of Sioux Falls, Minnehaha County, Avera, and Sanford. So I think it's so unique that have this full community attention on this. So Carla, in the work you do you see a need for a facility like this?
I'm very excited about it, but I do have to say Sioux Falls has been very proactive across the years. We have the mobile assessment team, which came to help law enforcement to kind of assess and to figure out and to talk with patients to kind of figure out what needs to happen. Then we had our law enforcement people. They are highly, highly trained in how to really kind of, in a very short period of time, figure out what the need for mental illness, what is the risks, what are going on with a person in a very short period of time. They're very good. So this is just, to me, another continuum continuation of helping people out, trying to figure out what they need at a dark time in their life. So I think it's an excellent program.
So once the link is open, and either one of you or both of you jump in on this, once it's open, let's say, we're a year down the road and it's been open for a year, what do you hope we'll start to see in this community?
Yeah, I'll jump in, Carla. But I would hope that what we see is a lot of the folks that right now are in and out of services, bouncing around, but not effectively moving forward in their lives. I hope that the link becomes a place where, whether you're homeless and on the street or struggling at home with family and things, the link connects you to the right services so that you begin to achieve some level of wellness. So I think it's wonderful that we will have a resource. My hope is, though, that that resource moves people back into healthy, productive lives. So that would be the ideal outcome. I could see things such as fewer people homeless or fewer people on the streets, because so much of that ties back to addictions or mental health issues. So I think it's fair to dream big and aspire for life-changing events. So that's what I hope.
How about you, Carla?
Well, I could wish for some continuity of care. So if somebody is going back to the same place, I mean, the one thing with alcoholism is it will cause a lot of people to feel guilty, and the one thing that appeases the guilt is more drinking, and so it becomes an endless circle. And so by having somebody around who can always be offering, there is something else. There might be another, because people have given up on a lot of folks, and so to have that continuity of care to continually offer something for folks and not give up on them, I think would be a wonderful advancement towards the next phase of their life.
Absolutely. So as we wrap up today, how do we take care of our own mental health in this time that we're still socially separated, going into winter, dealing with maybe holiday stress? So can you each give one good tip? Well, how do we take care of ourselves?
I personally use lights. I use light therapy. I started it early. I typically don't start until January. I started it already. Light therapy helps to offset what you lose in the wintertime for moodiness. And so I recommend it to a lot of folks. It's very natural, and it's inexpensive, and it just takes a little bit of time.
I would say use your connection to other human beings. We're all having to adapt to new ways to interact, but to me, to work and to love, to be productive and to have relationships that are meaningful, you can achieve that in a lot of different ways, but if you kind of keep those as your goals, I think it will be very helpful.
Thank you so much for being here today. We want you to know that you are not alone. If you are experiencing any issues with mental health or substance use, or somebody that you care about, please reach out for help. We want to know that there's no stigma, there's no shame in asking for help. We all need help from time to time. You can find resources on our website, www.livewellsiouxfalls.org. We have information on everything from depression and stress to anxiety and other mental health and substance use issues, with some links to resources. And keep watching for more information about the link. There is a website now, linksf.org, where you can kind of keep up with the progress on this project. We're grateful to our partners here at the city, with the county of Era and Sanford, for making this dream of the link possible. We want you to stay well, and stay tuned for the next episode of the Live Well Health Feed.